Well, I know Janet discussed with me that she had a woman that she was fitting for prosthesis one time, and she had problems. The history was that she had some problems with implants. And when she tried to get those implants removed because she was having problems with them, it was hard. The original surgeon wasn't around anymore, and nobody wanted to touch him because they didn't put him in. So that was one of the difficulties, is that, a surgeon doesn't like to do surgery on somebody else's surgery.
Right.
So I don't know what your experience with that is, when how a patient finds a surgeon that will do that. Is that pretty common to do now, or?
I think it's becoming more common, and in fact, there are a couple of female um, surgeons in, I think they were in the Denver area at one time, who all they do now is explantation.
Oh,
They
really?
will
Okay.
not place them. And there's another a couple of surgeons in Georgia that I know of, in the Atlanta area, same thing. They will not put breast implants in women anymore. They focus fully on explantation. And you have to be very selective about your breast explant surgeon. You really need to do your research and see how many surgeries they've done, what types of testing do they do at the time during the surgery. Are they taking swabs, checking for certain pathogens, malignant cells? Are they taking out the capsule? Because that is very important, because a lot of surgeons will try to talk their patients out of removing the capsule, which is that scar tissue that develops around the implant. And that has to go too, because it can still harbor a lot of pathogens,
Right.
malignant cells. The scar tissue can continue to grow into places. I've heard of it growing up people's neck, and
Wow.
also impacting their heart. It can calcify, and it can cause radiographic misinterpretations because of that. So, and a lot of women have had a second surgeries to go back in and remove all of the scar tissue and the capsule,
Wow.
because their surgeons didn't do it the
Yeah.
first time.
So it sounds like there are options now,
Yes.
because it's getting a little bit more common to take these out. So there are some options. You mentioned some people could probably find. So you mentioned the detox after you take the foreign body out. You being a functional medicine doctor, you're excellent at detoxing. So what's the process of that?
Yeah, so it's different for each person, right?
Yeah.
Because a lot of people have it's not just their breast implants that were causing this high toxic burden, but this could have been a person who, eats junk food, doesn't get
Yeah.
enough rest, drinks a lot of alcohol. So you have to deal with all of that as well. So basically, you're just trying to restore gut health, because you have to do that first. Gut health is everything. So we have to
Yep.
restore gut health. We have to make sure that the liver has all the nutrients it needs to do its job, to detoxify. And sometimes we can test for heavy metal levels like mercury and lead, and we know how to use chelating agents to draw those out of the tissues and help the body get rid of that. That is a very prolonged process. It doesn't happen overnight, but it's basically trying to get the patient to clean up their lifestyle, because that goes a long way too. But there's, infrared saunas, hyperbaric
Hmm.
oxygen chambers, sweating. We know that you can get rid of a lot of this stuff just purely in your sweat. So there's a lot of things involved in detoxification. It's not just drinking celery juice. That's
Right. Right.
that's that I'm not going to say don't do that. Okay, it's
Right.
probably not going to hurt you, but it is much more involved than just drinking some celery juice.
Well, and I appreciate you going into detail of that, because I don't even like using the word detox sometimes, because it brings that bad connotation, because you see all these advertisements for, a detox supplement or whatever. And
I know.
it's like, it's just not that easy. I mean, there's
No.
a reason you had the toxins in the first place, probably because, your lifestyle leads to that. So you,
Yes.
you need to change that first
Right.
and then try to eliminate them.
Right. Yeah. And then it's also, going around and trying to find all the other sources of the toxins that could be inhibiting your body's natural abilities to get rid of this stuff, because the body has this built-in system to get rid of things that are harmful to it. So it needs to
Right.
be operating well to do that. And that comes from living a good, healthy lifestyle.